Et j'invite maintenant Lyndon Jones, Pascal Botuil et Brigitte Couture à nous rejoindre sur scène pour notre conférence sur la bonne connaissance des produits d'entretien.
Bonjour. That's all I got. My apologies for my terrible French. So it was decided that we would give this lecture in English, but the slides are fortunately in French, and my thanks to Camille Schmidt for translating all of my slides, and if there is an error, it is her fault. So remind her. My name is Lyndon Jones, and I'm Director of CORE. CORE is the Centre for Ocular Research and Education. We are based just outside of Toronto in Canada. These are the research partners who support the work at CORE. So here are my disclosures, and you will see that I work with anybody. I am not proud. Also, we have a number of funding agencies who support our work as well, but the talk today is very generic. So what we're going to do is we're going to look at contact lens solutions. And my two colleagues following up will be providing some clinical data. My job is to go through the chemistry of what's in contact lens solutions. How exciting is that? And before you leave and have lunch, we will have a chemistry test. So you need to listen. Making contact lens solutions is actually really hard, because you want contact lens solutions to do lots of things. It has to be able to disinfect the lens. That's the number one important thing. It also has to remove tear film deposits. It's got to improve lens comfort. And while doing all of that, it has to be not toxic to the eye, even though it's toxic to the microorganisms. It's got to be compatible with all of the chemistries of the contact lens materials that we prescribe. It's got to be simple, quick, and inexpensive. That's a lot of stuff, okay? Which is why when you ask companies that make drugs and make contact lens solutions, many of them will say it's actually easier to make a drug than a good contact lens solution. It's really hard. So bear that in mind as we go through the chemistry. So what are the major components of contact lens solutions? What's interesting is that as we've seen the numbers of daily disposable lenses go up, innovation and research in contact lens solutions has gone down because there's less interest in it. However, today, still about 50% of contact lens wearers use reusable lenses and not daily disposables. So contact lens solutions remain very important. Now, you can divide the major components into 4 different groups. Biocides, or the disinfecting agents, surfactants, wetting agents, and something called chelating agents. So let's look at those in detail. We're going to start off with biocides. And this really is the most important thing because these are the components that disinfect the lens and ensure that when a patient puts it back in the morning, that lens does not give them an infection like this. And we know that contact lens patients are stupid. Would you agree? Patients are stupid. They do stupid things. So you have to make the contact lens solutions work with stupid people. That's why biocides are really important. So, historically, contact lens solutions back in the 60s and 70s were disinfected with things like thimerosal and chlorhexidine. But that caused massive numbers of allergic reactions. About 1/3 of all patients became allergic to their contact lens solutions. And that's what drove the development of hydrogen peroxide. So hydrogen peroxide came out in 1971, and then the other two initial agents, polyquad and PHMB, came out in about 1986, 1987. Okay, so we've had those preserved systems that work fine and don't induce, in many patients, allergic reactions since the mid-1980s. Now, those more recently have been added to with two other newer biocides. The first of those is alexidine. Now, alexidine is actually fairly closely related to chlorhexidine, and it came from mouthwash. So it's been used for many, many years by dentists and by people looking at killing bugs in the mouth. So that's where alexidine came from. The newest preservative in contact lens solutions is povidone iodine. Now, povidone iodine has been used for many, many years to clean the skin. It's very, very good at killing bacteria, exceptionally good. And it's been modified to work with contact lens solutions by adding PVP to iodine to make this this povidone iodine. And it releases iodine gas, which oxidizes various chemical bonds within the components of microorganisms. The other interesting thing about povidone iodine is as the gas gets released, it's actually able to disinfect part of the case that isn't contacted with the solution. We know that when we have traditional cases, when you screw the top on, peroxide or preserved, there is a gap between the solution and the top, the inside of the case, the top, that isn't disinfected. Iodine gas does disinfect that area, so the inside of the case top also gets disinfected, which is very important. The PVP, the povidone iodine in the solution, is then neutralized by adding a tablet that contains ascorbic acid. So it does need a neutralizing system. Okay, so initially we only saw contact lens solutions have one biocide. Now what we're starting to see more and more is that contact lens solutions have two biocides, or maybe even three. And the reason for that is that by using two different biocides, you increase the range of disinfection capacity, making it more likely that all the bugs will be killed. So we can see here a list of the dual disinfecting systems. Most of them initially used polyquaternium in addition to another disinfectant. And again, then the most recent one, Oftex Cleardew, uses PHMB plus alexidine. So these are all the dual disinfectants, and what we see from Bausch & Lomb now is a triple disinfecting system. So this is, again, a unique system that has three different biocides in an attempt to give a very broad range of disinfection capacity. Okay, so we've gone from single biocides to dual biocides in many systems, and now even triple biocides. Okay, so what's the difference between these different biocides? Really, a major difference relates to the size of them. We have very small molecules, and we have very big molecules. The bigger the molecule, the less that gets taken up into the lens. And that can be quite important, because if you only have a single biocide that gets taken up into the lens material, that leaves less available to kill the microorganisms. And that we see in a number of systems historically, trying to move the slide on here, has been an issue with certainly single biocide systems, because if there's an uptake into the lens, the first thing that you're concerned about is there enough disinfection left to kill the bugs? And then secondly, when I take that lens out of the case and put it onto my eye, the release of that biocide, or indeed other agents, may cause corneal staining on the eye. We'll hear about corneal staining and the interaction between lens materials and components of care systems in one of the next talks. In terms of efficacy, in order to bring a product to market, you have to be able to show that a contact lens solution can adequately kill 4 bacteria and 2 fungi. And if you can, and if you can do that, then you can bring the product to market. However, it's only against those 6 microbes that you have to show efficacy. And so the problem is that you can bring something to market that actually has very poor efficacy against other agents. And as a result, what we've seen is 2 products taken from the market. Bausch & Lomb's Renew Moisture Lock, because it had poor efficacy against a certain type of fungus, and the AMO Complete Moisture Plus, because it had poor efficacy against acanthamoeba. However, during the production of those, they were never tested against those organisms. That's why it's important that we use a product that has a very, very broad range of microbial activity. Now, interestingly, oxidative products, so by oxidative products we mean they actually oxidize the bugs and kill the bugs in that way, and these are peroxide and povidone iodine, actually show very, very good activity, not just against the standard test that we need, so those 6 microorganisms, but they show very good efficacy against acanthamoeba, which you do not need to test against to bring a product to market, but they have very good efficacy against acanthamoeba and even against coronaviruses. So we published a paper a couple of years ago where we showed that these 2 products, peroxide and povidone iodine products, actually kill the coronavirus very effectively. Okay, so that's the biocides. Next we have surfactants. And surfactants are effectively soaps. And their job is 2 functions, because these surfactants have 2 very different ends. They have a hydrophilic end that's wettable and a hydrophobic end that's non-wettable. And one of the things that surfactants do is they clean the lens. And they do that because the hydrophobic end grabs hold of the deposit on the lens, and the hydrophilic section goes into the solution and removes the deposit from the lens surface. The other things that surfactants do is they help with wetting the lens surface. And they do that because the hydrophobic end attaches to any hydrophobic or non-wetting areas of the lens, leaving the hydrophilic end to wave and wet the surface. Okay, so the hydrophobic end binds to the lens, and the hydrophilic section helps with wettability. So that's the job of surfactants. They are supplemented and assisted by wetting agents. Now, wetting agents don't perform any cleaning function. Their sole purpose is to help the lens surface wet and improve comfort. By improving the lens surface, they also improve vision. Because in order to have good vision, you need a very wettable surface. As the surface dries, so a patient's vision will drop. So wetting agents are very important for comfort and vision. Now, in optometry, we use wetting agents in 2 ways. This polysaccharide-based wetting agents we find in ocular lubricants. So in lubricants that we prescribe for dry eye patients, that's where we see these polysaccharide-based wetting agents. However, while they are very good at sticking to cells on the cornea and the conjunctiva, they are terrible at sticking to the plastic of contact lens materials. In order to do that, you need a different class of wetting agents, and that's these. These are what we call surface active polymers. And these surface active polymers, again, have two very different ends. They have a hydrophobic end and a hydrophilic end. And just like the surfactants, they do the same job. They stick and bind to the lens surface, and the hydrophilic section helps to wet the lens. And there are four categories of these surface active polymers. The ones that have been around for many, many years, going back to the 1980s, are the top two, the poloxamines and the poloxamers. And when you read, I'm sure you always read the composition of the contact lens solutions that you're prescribing, you'll see things called tetronics and pluronics. And that's what those are, okay? So they're either poloxamines or poloxamers. The bottom two are two newer agents, EOBO and HAD. So EOBO found in Alcon products and HA derivatives found in the Cleardew components. And these are specifically made to help wet silicone hydrogels, because the hydrophobic section of silicone hydrogels means that the lens surface is more hydrophobic than hydrogels, and those two agents, EOBO and the HA derivatives, actually specifically are made to bind to those lens surfaces. The final section then are chelating agents, and chelating agents are found in pretty much every contact lens solutions, in particular the top one, EDTA. EDTA is found in 99% of contact lens solutions, and that's because EDTA is an agent that removes metal ions, and metal ions are needed by microbes to metabolize. So by removing those metal ions, the metabolic rate of microorganisms are reduced, and it helps with the biocide to kill them. So that's the function of EDTA. Sodium citrate is found in Alcon products. It's particularly there to remove protein. Okay, now with silicone hydrogels, protein is not really an issue, but with hydrogels it is. So sodium citrate helps remove protein deposits, particularly for hydrogels. And the bottom one, hydronate, is only found in one product. It has a very long name, hydroxyalkyl phosphonate. It's only found in Renew Fresh, and it also removes protein deposits. Okay, so those are the four components. And what's important, I think, for us to take away is that modern solutions are very, very complex. They're not all the same. And they don't all perform the same with different contact lens materials or perform the same for different patients. So if your patient is struggling with contact lens performance, don't necessarily only change the lens, think potentially about changing the contact lens solution to optimize that interaction between the lens and the solution. And with that, I will say thank you very much.
Bonjour à tous. Alors je vais essayer d'être aussi performante que Lyndon, que je remercie beaucoup pour sa participation. Et donc moi je vais continuer donc cet exposé en parlant donc des